Hi, my name is Dr. Wanda, a clinical and radiation oncologist at SHO, Kenyatta National Hospital with BUON. I'm pleased to be with you here today, and the topic for discussion for the day is prostate cancer. When we look at data in Kenya, prostate cancer among men is the leading cancer. In terms of statistics, 21.9% of all the cancers are prostate cancer in men, and it's the leading cause of both mortality and morbidity, meaning disease and also causal death. So why should we discuss prostate cancer? Because it affects many men. Sometimes the symptoms are insidious in onset, meaning there's some symptoms a man can look at. Ideally, what is the prostate gland? If you look at the anatomy, the prostate gland is a small walnut-sized organ, just at the base of the bladder. What is its function? It produces fluid that nourishes the sperm. Part of the spermatic fluid comes from the prostate gland. Through it, in the middle, is where we have the urethra. Normally, as a man ages, the prostate gland enlarges with size. And this is occasioned, and what a man would notice that previously, the urine stream would go very far. But over time, the urine stream reduces in the distance it can go. So that is one of the symptoms that one might notice. Difficulty in passing urine, feeling like they have not been able to empty the bladder fully. Some may present with pain, maybe back pain, as the lesion now affects the nerves around that area. Why are we talking about it? It's because cancer of the prostate has a slow progression. It's one of the cancers that's not very rapid in growth in majority of the cases, meaning it gives us a long time between the time it starts to when it develops to full-blown cancer. So what should a man do? It's very important to be able to have self-awareness. If you notice that your urine stream is going down, if you notice that you're having problems with erectile dysfunction, these are aspects that should be discussed with your doctor. Most men are not comfortable to discuss erectile dysfunction, which is one of the symptoms of prostate cancer that can develop. However, once noted, we can be able to look out for the symptoms and decide on how to assist the patient. So many people ask, can I be screened for prostate cancer? Screening for prostate cancer is quite controversial. However, if there are symptoms or a strong family history, then screening can be one of the modalities we use to look out for the cancer. How do we screen? One is using the PSA level. The prostate-specific antigen, PSA, is produced by the prostate gland. When the levels are high, it can be an indication of cancer of the prostate, prostatitis, and any other infection about that area. Hence, not a very specific test. Most of the time, we use the PSA to monitor disease progression as we go on with the treatment to see how are we progressing. However, what can we do? A doctor can be able to do a digital rectal exam. What's a digital rectal exam? It involves a doctor inserting a finger into the rectum and feeling for the prostate gland. What does the doctor feel? We try and see, is the prostate regular? Because it has two lobes and a middle raphe. Want to see, is it regular? Are there bumps on it? Is there the mucosa free? Or any signs that the prostate gland is either enlarged or has a bit of roughness on it? That can be done. An ultrasound can also be done to look at the prostate gland. It can either be done superficially or through the rectum, a transrectal ultrasound, to guide the management. So once a lesion has been noted either by a DRE or an ultrasound, then an MRI would be recommended. Why an MRI? An MRI is very specific. It enables us to have very good soft tissue differentiation, and it would show us a lesion that would need to be biopsied. And remember, in oncology, we say tissue is the issue. So until we get a tissue diagnosis, we cannot make a diagnosis of prostate cancer. So once a lesion has been identified through the MRI, we will need to take a small part of the tissue and take it to the lab so that the pathologist can examine the tissue and be able to tell us whether they see cells that are cancerous. Majority of the prostate cancers are adenocarcinomas. That means the cells seen are named adenocarcinoma by the pathologist. Once a diagnosis has been made, we would like to grade it. Is it grade 1, grade 2? And that tells us how close is it to the normal tissue? Is it well differentiated? Is it not well differentiated? And then we do what is called a Gleason score. That is a score of the cells that are seen in the microscope, just to see how are they behaving, how do the cells behave. So once diagnosed with prostate cancer, treatment is available. We have very many avenues for treatment based on the stage when you present. How can one be treated for prostate cancer? One can be surgical. That means an operation is done to remove that area that has the cancerous disease. Two, we can give radiation. Radiation can be in the form of brachytherapy, which involves inserting seeds into the prostate so that they can release radiation for treatment. We can also have external beam radiation. This means the machine gives radiation from the external source, focusing on the prostate gland. We also have medical management, which may include hormonal manipulation, because cancer of the prostate is really fueled by testosterone. So there are hormones that can be able to lower testosterone levels to ensure that the patient is able to do well. We can also use chemotherapy as a form of treatment. All these treatments are based on your stage and also after discussion with your oncologist. Thank you very much for joining our discussion on prostate cancer. Kindly join us for the next discussion on another cancer.